My name is Norm Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Hello, and welcome to the Digital Health Heavyweights podcast with your host, Norm Volsky. And today we are thrilled to be joined by Tom Cassels. Tom, welcome to the podcast.
Thank you. I'm happy to be here.
Excellent. We are happy you are here. So, for all of our viewers and listeners that don't know Tom recently joined Manatt Health as managing director, where he works with strategy, innovation, and commercial teams at health tech and digital health companies, life sciences companies, health systems, health plans on innovative business strategies and go-to-market plans, while also providing insights and due diligence to PE and VC investors. Tom is also an executive partner at Health Enterprise Partners, as well as a board member and advisor to companies from early stage to growth equity organizations. Previously, Tom was president and CEO of Rock Health Advisory, and also was a national partner at Optum Advisory Services / 15 plus years at advisory board company, which got acquired by Optum. Tom has a BA in psychology and a master's in public policy from Georgetown, and we are thrilled to have you join us. So thanks, Tom. And we'll dive right in. What encouraged you and inspired you to get into healthcare early in your career?
It's a good question because clearly my education wasn't it. I was really intrigued at first. So my first job out of undergrad, I spent a little under 2 years in the Jesuit Volunteer Corps. I was a teacher living in Camden, New Jersey, took a vow of poverty. So it was the only time that I was a Medicaid recipient. And I had gold-plated insurance my whole life. And life got different and fair real fast. And so I knew something was very, very broken for me and for people like me who were carrying that card. So that's actually what drove me into public policy school. Statistics almost drove me out. But I was really lucky to find the advisory board right out of graduate school. That 15-year experience was probably the greatest education I could have asked for.
Fantastic. Well, we're glad you made the leap to healthcare. You've led the launch and growth of multiple strategy consulting practices. What was the early strategy there to build a consulting?
Do hard work with good people and don't overpromise. At the advisory board, I was working really predominantly with health plans and health systems. And what I learned very quickly, it doesn't at all matter what I think the right answer is. It only matters whether the process I use gets people to believe that's the right thing for them. And so really teaching that, and when I got to Rock Health and really zeroed in on digital health strategy, it was find people who were as dorky as I was and wanted to focus all of their time in this domain.
I'm a self-proclaimed and proud healthcare nerd myself.
Yeah.
So
we recruited for at least 2/3 nerd or greater. But the question I always trained everyone to ask was, what's the job that you're trying to do? And really focused on kind of creative ways we could get people to ask and answer the right question.
All right. What was your strategy on team building, and what did you do to encourage that growth?
So my strategy was, everybody says hire people smarter than you are. When I started, I had someone smarter than me. So Megan Zweig, who is has taken the reins at Rock Health, for example, was leading research.
Mm-hmm.
And I got to know Sari Kaganoff, who at the time was an associate principal at McKinsey, working on digital health strategy and their digital health network.
Mm-hmm.
And, what I asked from both of them, run your business lines, make decisions and tell me what they are, be able to answer my questions. And I promise I'll do everything to, move barriers out of your way. So step one is don't make yourself indispensable.
Mm-hmm.
That's something that I truly believe. And then step two is maximum authenticity.
Mm-hmm.
So the only interview question I've asked in, I don't know, 10 or 15 years is, what do I have to know about you to actually know you as a
Mm-hmm.
person? And it's almost never work related. But, the thing I offer is I'll start. And, we started with a really small team at Rock Health. We got to a little over 30 folks.
Mm-hmm.
And I got to have that conversation with everyone. And
Out of
then,
curiosity, what do you tell them about you?
I tell them two things. Maybe this also brought me into healthcare. I live with a serious mental illness, and I have a child who's neurodivergent. So healthcare is today very close to my heart.
Mm-hmm.
And so I don't look at this as just a business.
Mm-hmm.
And I also have to take care of myself. And that means I make certain choices as a leader, and you should feel comfortable to be 100% of yourself here too.
Mm-hmm. Okay. Love that level of transparency. I think it's great. I think everyone can learn from it. I might, tweak my interview process myself based on what you just shared. I really enjoy that. I think you bring a really unique perspective because you've worked with health systems, you've worked with health plans, you've worked with digital health companies. There's just so many stakeholders in the healthcare ecosystem. What are, some things, or what is one thing that many people don't understand about the US healthcare system that you think is like a glaring piece of information that like would be really helpful for someone who doesn't live, breathe, sleep this market? Like, what should they know?
They should know everything in healthcare is part of a system.
Mm-hmm.
So don't ever say the word solution unless your product has 15 immediate users. You're not solving a system problem.
Mm-hmm.
You're making it potentially easier to work within a system that evolves very slowly. So I think there's an incredible optimism
Mm-hmm.
amongst people who are innovators inside the healthcare industry and innovators who come from outside the healthcare industry to really believe that you can start with the physician and change from there, or start
Mm-hmm.
with the consumer and change from there. Start with the dollar and change from there. This industry is as multimodal as you'll get.
Mm-hmm.
And so the question really ought to ask is not, what problem am I solving for you? But rather, what problem do you deeply, deeply want help with? And I think that would answer a lot of the questions that we have around uptake, implementation, and continued utilization of technology in healthcare if people realize that.
Yeah. Very, very great wisdom. What were some of the biggest challenges you faced in your career so far?
The number one challenge is staying optimistic,
Hmm.
both from my own personal lived experience of the healthcare system and working very, very hard with different folks in different parts
Hmm.
of the system. It can be incredibly frustrating. It can seem irrational,
Hmm.
and it can seem like people are playing with uh, with other people's health.
Hmm.
And seeing how hard it is and using that as motivation is a lot tougher
Hmm.
than getting jaded. So I think that's probably the toughest challenge that I face is 20 plus years in being a really optimistic person, and feeling really strongly that we're not coming up with new ideas just to run into walls. So I think that's something, we lose a lot of great talent because it can be really off-putting.
Gotcha. Obviously, challenges are one thing, success is a lot more fun to talk about. What are the successes you're most proud of that you've achieved over the years?
That's a great question. One of the things that, and I did it twice today, a real success I've had is building teams,
Mhm.
and really getting to know those teams as people and keeping those relationships going. So I often kind of reflect on I should really just hang a shingle as a professional search executive
I
because
don't want the added
I get
competition.
I
Please,
get
Tom.
so
This isn't
so
the goal
many.
of the podcast, is to attract competitors.
Yeah, no. But you get into situations where, there were thousands of folks at the advisory board at Leidos, at Optum, at Rock Health that I've gotten to work with, and they're all they've moved around, they've had different experiences. It is a gift to have access to all these people,
Mhm.
and also in some cases to help them find new people to work with. And then,
It's certainly rewarding, I can promise you that. It's a
it
lot of
it
fun to see people who feel like, hey, I've done a lot in my career, but I'm kind of hitting a ceiling wherever they are and helping them find something that really allows them to utilize their full skill set and their full potential. Like there's no better feeling.
it is fantastic. And the other thing that I love, and maybe this is where my psychology degree actually does come into play. There are people that I started working with 20 years ago who still text me on a weekend to say, hey, I'm thinking about doing this. Is this crazy? And that makes it feel like, whether I'm, working with you or not, um, I'm a trusted advisor. And I think that's one of the best feelings that you can ask for is that, you know, win, lose, or draw, you're able to help people think through big decisions.
If only people in the industry knew how many jobs I've talked people out of, not only the ones like with my own clients and working, but like more of like, hey, Norm, found this on my own. You have nothing to do with it, but is this a good move? Like, is this like the right thing for me? And, sometimes I say absolutely. Sometimes I say hell no, here's why. And a lot of times I'm like, maybe like talk to these people in my network that might help you make the right decision. There's just so much behind the scenes than like what is on the surface, in a lot of people's decisions. So It's funny how
Absolutely.
a lot of people have reached out to both of us just to kind of pressure test ideas.
That's for sure. You better watch out now I know I can do the same with you.
You could. You could. So, as a board member, you sit on boards of several companies. What are your overarching values when it comes to being on a board and helping direct, a company forward?
The first one is humility. And that's not naturally the first answer that I think a lot of people would give.
Mm-hmm.
Um, with some of the companies have been around for over a decade. Some of the companies have been around for about 10 weeks.
Mm-hmm.
But what they need is not somebody to point out, well, this is how I did it in the past, or this is what you're doing wrong, but to actually ask questions about how are you doing it and what are you learning from them. So that to me is kind of the number one value. The second thing is candor, and that is not just about talking to the CEO and senior members of the team at a company.
Mm-hmm.
It's candor with your fellow board members. I think it's very easy to be quiet when someone is kind of over representing themselves, we'll put it that way.
Yeah.
But board members are there to serve the best interests of the shareholders and to support the CEO.
Mm-hmm.
And the last thing, kind of open-mindedness.
Mm-hmm.
So not every CEO is going to be somebody that I would want to have a beer with at an airport.
Mm-hmm.
But every CEO that I work with, I believe that they are the best leader of their team.
Mm-hmm.
And if I stop believing that, then it's my responsibility to say that, to, remedy what's going on, or to take a step away. Mm-hmm. So those are three things I think people should think about when they consider taking on a responsibility like a board seat. Mm-hmm. I know when I first took my first board seat, I thought it was just really cool. And then I realized, wow, this is a lot of work.
With great power comes great responsibility. Spider-Man. I love that. As a board member, how do you typically like to partner with your companies and with your CEOs?
I think, I can't remember the academic who said it, but he said, if you can't teach someone something, then you don't really understand it. Mm-hmm. So, I like to get involved and understand, okay, why are you doing this? Why is it important now? And who is it important to? Mm-hmm. And what are the active ingredients that make this work? So that I can understand and tell that story every time somebody asks me about the company, and actually be able to ask questions in return. Mm-hmm. And bring those questions back to the team. I think I certainly choose to work with companies that I can proselytize and mm-hmm. and kind of bring to my network and get really excited about. And so that requires not just being able to teach what the business does, mm-hmm. but to put my marker out there. And so there's a lot of give and take. And I think there are two people who really need to feel a lot of trust in me. And that's the CEO and that's her customer.
Mhm.
Because if they're part of my network and I steer them in the wrong direction, they're not going to be part of my network for very long.
Correct. Yep. You're only as good as your last intro in this game. So high stakes for sure. What's your philosophy on building teams specifically when it comes to like an early stage company?
That you gain more from quickly getting rid of people who aren't a fit
Mm-hmm.
than you lose from giving people who really are a fit for the culture and the business the time to ramp up
Mm-hmm.
in their roles. The margins for error are just smaller and smaller and smaller. So the only way to de-risk these early companies is to have great people around you and to make sure people who aren't fighting for you get the hell away.
Mm-hmm.
So I think philosophically that it doesn't matter what kind of business I'm looking at. I'm not talking about like who's not making their quota right
Mm-hmm.
now or who's got a quirky personality. It's like who's fighting for this business.
Mm-hmm.
And so that's kind of the center of my philosophy.
Okay. You've seen a lot of, the inside and the guts of digital health startups. What is a red flag that you've come to notice is like an emergency situation, like 5 alarm fire? Like, what are the things you look for and like will try to, intervene as quickly as possible when you see this situation?
When people can't explain why a particular customer renews and why a particular customer does not renew, that is the red flag for me.
And why and how do you sniff that out?
The expectation of perfect delivery, perfect performance, and that everybody is going to be able to use your technology is a big assumption.
Mhm.
And health systems being, health systems, health plans, employers, these are large, complex organizations.
Mhm.
Sometimes you're just not a priority. Knowing that you're not a priority gives you the ability to try to move up the order stack. And B, gives you the ability to say, this didn't work. We know weren't a priority.
Mhm.
So when we go back, we can say, what makes you believe that will be a priority this time?
Mhm.
So you can qualify that lead. And if you if you don't know why you're winning, um, that's very scary to me
Mhm.
because it means you can't replicate it. And
And if you can't also tell someone why you're not winning or why you won and don't continue to win with like a customer renewal, you're
mhm,
not able to fix the issue, so that will continue to happen.
yeah, and I would rather work with a company that has kind of plateaued in terms of growth, but knows why. Somebody who is, on the hockey stick, but is on the hockey stick because it's like AI, you know, AI platform words
Mhm.
and whatever the client needs, that's what we're going to do. It's like,
Mhm.
no, you're not.
Mhm.
Um, I can work with people who are honest with themselves, people who can't identify which side of an ace is up. I don't know what to do.
Okay. So you're kind of like a field of dreams guy, like build it and they will come. If you know why you're building it and what you're trying to accomplish, like you'll eventually find the right customers. But if you're just trying to build something very
Well,
general,
I think it's,
customize it, you can get in danger.
well, I tweak it a little bit.
Mhm.
if somebody has chosen to work with you, you should be able to tell with 80% certainty if they're enjoying. And I don't care what the answer is. It can be yes or no, because we can plan around a no or a yes.
Yes.
But if you think, you know what, everybody seems happy, or everybody is really busy, so if it's hard to get a read, then you aren't indispensable. And, I use that word probably too much, but the goal of every service provider, every technology enabled service provider, every SaaS company is make yourself indispensable.
Yeah.
It doesn't need to be in a sexy way, but just really embed and have people kind of depend on you and be dependable. That's the goal.
Absolutely. What are core traits you look for in a startup founder, especially in this space?
Resilience, storytelling ability.
Couldn't agree more on both of those.
I think you can have an amazing product, but if you can't tell the story, nobody's going to know.
And if you can't personally, you need to find someone who can.
Yeah. That's very true. Yes. Find my partner, Chrissy Farr. She's excellent at it.
I love Chrissy.
So comfort with ambiguity, because there are brilliant people who stop functioning when you have to make a decision without
All the
perfect or any information. But being a CEO is about taking decisions and making choices and doing it in a timely fashion. Beyond that, you can improve in lots of other ways, but people can tell when an important choice needs to be made to move forward and you're just not making it.
Yeah.
And so that would be the last one, I think, is really core.
Yeah, very, very insightful. As managing director of Manatt Health Strategies, what are you focused on?
I am focused on something that I've never had before, that's really kind of an embarrassment of riches. So Manatt is an integrated professional services firm. In our healthcare business, we work at the nexus of policy, legal, and business strategy.
Mhm.
So what I have always done is I've always been able to work with folks to get to a place where there's a conviction amongst the team that the direction we're taking is correct.
Mhm.
And then the general counsel weighs in, and then compliance weighs in, and then accounting weighs in. And what I am doing right now is really learning the different skills and the lenses through which my team looks at a problem. And looking at that problem, I'm accustomed to looking at it through a business model and competitive strategy lens. Chrissy is used to looking at it through a strategic communications lens. I'm lucky enough to work with people who literally written payment policy at CMS. So looking at it through a payment lens, it's great to just incorporate these different skills. And I've never seen a firm really commit to doing business differently. Most of the work that we do at Manatt Health is, fixed fee consulting work, which means there are lawyers that are not billing you hours.
Mm-hmm.
There aren't a lot of firms who have figured out how to do that.
Mm-hmm.
And so I'm really proud to get the chance to work on these multidisciplinary teams and to work with folks who, I could not work on a project for the state of New York in their 1115 waiver before, but now there are ways that my expertise can support work that is going on there. And so that's it's a real kind of grateful moment for me.
That's great. What's the ideal client types that would make sense to maybe reach out to you and Manatt?
For me, it's folks who are interested in growth.
Mm-hmm.
That fundamentally is what I've always done.
Mm-hmm.
We focus on people who are working with state and federal programs.
Mm-hmm.
We work a lot with organizations that are representing a large number of folks in a field, and we work with some of the most innovative life sciences companies who are really looking at not just what is the kind of feasibility of our work, but the viability, and that the policy, legal, payment, and go-to-market strategy really comes together there.
Okay. Excellent. And can you give us an overview of your new role as executive partner at Health Enterprise Partners?
Sure. So I've known the folks at Health Enterprise Partners for a really long time. Again, Ezra Mailman was a former advisory board colleague, so there's never more than 2 degrees of separation.
Yeah, it's like the Kevin Bacons of healthcare
there you go.
advisory board.
So executive partners really engage, I'm going to be engaging in 2 ways. On areas that they have kind of deep experience, I'm going to be working with portfolio company CEOs, and in some cases, taking board seats, that where I can kind of bring an outsized impact from HEP's perspective. That's what great investors do. It's what they do after the check. And there's a wide assortment of really talented people that I'm going to get to learn from and work with. So I'm really excited about that. And it gives me an opportunity to stay kind of vital and close to the startup and investment world, which frankly is advantageous for kind of large Fortune 100 clients who, it sounds crazy, but the bigger you get, the harder it is to really relate to true, new applications in your space. So I hope I can be really valuable to HEP and our portfolio companies and stay kind of a trusted partner to a lot of great people I've met in the VC and PE area.
Fantastic. What are your top 3, hottest areas of digital health right now in 2024?
I guess number 1, use cases over buzz. So a lot of money. You could make an argument that there aren't any companies getting funded who aren't talking about how they're using AI. In my view,
no one's getting fired right now at investment firms for investing in AI. If you invest in something else and it flops, you're going to have some explaining to do.
Yeah. My personal take is there are no AI companies. That's like saying I'm a math company, because you use logic data and compute power. What end? And I think there's going to be real results for companies that have found problems that yield well to use cases of AI, real problems for companies who are just building the biggest models they can. And they'll find out how to use them once they have customers. So that's number one. I think number two, how we approach chronic disease management in the face of what are being marketed as cures in the cell and gene therapy, the biologic space. And I'll say it, GLP-1s. These are all amazing innovations, but what also research from the American Medical Association will tell you is the average patient on a GLP-1 stays on a GLP-1 for less than 3 months. The side effects are a huge issue. Even if you can stay on GLP-1s, you still need to be treated for behavior changes that are necessary to make you a healthier, lighter person.
Yeah.
And when it comes to cell and gene therapy, we think we had problems with supply chain when it came to the COVID boosters. It's going to be that and then some.
Yeah.
When you think about where and what programs are going to have access to these treatment options, how are we going to make sure that, with 50 states deciding how they're going to or whether they're going to pay for things, how do we make sure that we have strategies that will allow us to generate a return on a program? And so I just think the concept of cure versus care management is the second question. And the last thing I would say is automation versus activation is going to be the last big one. How much can we use technology really augment how human beings do their job, or take away jobs that human beings are doing? Is going to answer the question of, can we do better what we're doing now? And can we do better things because we're not having to do what we do now? So that was a pretty long answer to a direct question, but those
healthcare is
three
complicated. So
complicated
questions bring complicated answers.
Yeah, those are the three things that they keep me up at.
Okay. Well, it's a good dovetail into my last handful of questions around how do you practice what you preach? Me, you, people like us, we breathe, sleep, eat healthcare all day long. But at some point, we go home and we have a personal life. How do we, participate in wellness? How do you exercise? How do you reduce stress, in stressful environments?
I think the only thing that has ever worked for me, and I swear by it, is just don't take myself that seriously. If you want somebody who is never going to make a mistake or is always going to be on, congrats when you find them. That said, don't take care of myself. I am a huge hypocrite. I can do a lot better, frankly, as a parent. That's the motivator for really improving how I follow the advice that really smart people give me about, both healthy behaviors and reducing unhealthy elements of my environment, like my cell phone, which at least is on mute,
Mm-hmm.
but keeps popping. Maybe reduce those notifications.
Yep. Hey, it's great. And I think the other thing, that obviously is a big determinant of health is what we're putting in our bodies. It's a huge factor. I've found that, a lot of people just don't know where to start and they just need a little inspiration. So out of curiosity, like, are there any healthy meals that you and your family either prepare or you buy and pick up pre-assembled that like is part of your routine that might give someone the idea to maybe try it themselves?
So this will sound odd, but I went with my family to Germany
Hmm.
during the Euro Cup. Got to see a couple of games. It was a fantastic time for the country. They were very, very proud to be hosting.
Yeah.
And people just eat differently, specifically at breakfast,
Hmm.
in ways that change your hunger levels
Hmm.
across the day. And so we've just kind of kept going with,
Which was, give me a little
um,
insight. Like, how did they
you
eat
know,
different there?
yolk, cheese, birch smoothie.
Hmm.
And so trying to focus on, really making that first meal of the day something that's going to, stick to the walls of your stomach
Hmm.
for the rest of the day is something that we do as a family.
Cool. Yeah, I think there's a saying, it was definitely in that like Living to 100 documentary on Netflix. And I think it was something to the degree of eat breakfast like a king, lunch like a prince, and dinner like a pauper. Like you just want like a big meal, then like a pretty nice sized meal, and then a small meal at the end.
That's
So
right.
if you eat a bunch of good nutritious food early, you're not going to be so hungry late. So again, Tom, really enjoyed this conversation. Thank you so much for joining
Thank
us on
you.
Digital Health Heavyweights podcast. Congrats on all your success and excited to see what's to come. And, again, thank you for sharing these really valuable insights today.
Well,
Thank
I'm
you.
really grateful for the invitation. Thank you so much.
Thanks for joining. Appreciate it. Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.